Independence should not come at the cost of safety. Most seniors want to stay independent as long as they can, so long as they can. Technology is not about replacing care, it's about peace of mind. Hi, my name is Andi, and today I'm going to show you how simple, non-intrusive technology can be for your loved one. Many families that are not local worry about falls, medication issues, confusion, changes in behavior that often go unnoticed. Seniors often resist technology because they think every conversation that they're having is being heard and videoed, and it is not. I'd like to introduce an intelligent and incredible technology that Andi's Angel Home Care uses with traditional home care, using Sensi as blended care or a standalone feature. These are some of the benefits from Sensi. Sensi detects falls, possible UTIs, bladder infections, respiratory complaints. Once Sensi is integrated into the home, we establish the client's baseline for things like UTI, fall prevention, medication errors, upper respiratory, back and leg pain are just a few of the things that Sensi detects. So one example that we had with Sensi is we established the baseline of the client, and she was only getting up 1, maybe 2 times a night to go to the restroom. But for 3 days straight, she was getting up 4 and 5 times. When we got the alert, we called the client to ask her if she had any burning with urination or not being able to empty her bladder with ease, and she said she is not. So we reached out to the emergency contact and told them that we suspect a UTI and we feel like it would be really good to get her to her primary doctor. The daughter took her mother to the doctor, and the doctor tested her for a UTI, and it came back immediately with an infection. It's important to know what type of UTI infection you have so they know what antibiotic to give to you. So because we had Sensi and got her to the doctor before it got out of control, she was put on an antibiotic and within 48 hours felt great. Another example of Sensi is we had the baseline of one of our clients, and we came to him with a cough. It was a persistent cough. And Sensi picked up that he was coughing more and more and more day and night. Well, Sensi picked up on that, and we called the daughter to let her know that Sensi picked up more frequent coughing by her father and suggested that she take him to the doctor. She did the following day, and the doctor tested him for COVID and both flus, and COVID showed up within 15 seconds. Other detections Sensi picks up are calls out for help, like help me, I fell, I'm bleeding. Physical issues, hearing issues, medication errors, mood changes, and dizziness are just a few of the other detections Sensi picks up. Sensi also picks up activities of daily living difficulty. If someone's having a difficult time walking or bathing or dressing or toileting on their own, Sensi picks up those alerts as well. One of the best things about Sensi is early detection. If we can get the client to the doctor before anything has increased, we can keep the client out of the hospital, then rehab, and then back home. A cycle that is not good for the client. Sensi is very beneficial to the families because Sensi is there when families can't be there. When Sensi is in the home, then this is an ideal way of knowing that the next level of care is needed. When you have a caregiver and Sensi in the home, it makes the caregiver accountable, but also it shows the caregiver what more need is there for that client. So Sensi in the community, whether it's independent living, assisted living, or memory care, is a great tool to have. So we all know that Most of these independent living communities are understaffed, and Sensi can pick up what is going on every minute of the day instead of a 3 or 4 hour check-in. Some of the key features is that Sensi is audio only and fully private. Sensi does not record conversations. Sensi picks up 40,000 keywords, phrases, and sounds. For instance, if someone says to you, "How was your night?" and you answer, "It was awful. Sometimes I just feel like dying." Dying is a keyword that will be picked up. If someone asks about the wound on your back and you say, "It was oozing and bleeding and sometimes I just feel like hurting myself," Sensi's going to pick up hurting yourself. We will be alerted to those keywords and called to make sure that you're okay. Sensi works 24/7, even when caregivers aren't there. This is a great way for adult children and family members to have peace of mind, knowing that we will be alerted and then we will alert the family. If you're interested in learning more about Sensi AI, please reach out to andysangels.homecare.com.